Hello, good afternoon. My name is Dr. Chudi Ufondu, and it's SGHS. It's weekend, it's open clinic, and today we're talking about diabetes. Very important topic in our community. So please, when you join, sit back, introduce yourself, and let's know who you are, your location, and we talk about diabetes. I intend to help you to understand what diabetes is all about. Then after understanding what diabetes is all about, I intend to help you to know how to prevent developing diabetes. Diabetes is a very deadly disease, and thankfully, with appropriate lifestyle modification, you can prevent developing diabetes if you are not diabetic. Even when you have family history of diabetes, you can modify your lifestyle and you might be in a better position to avoid developing diabetes. If you already have a diagnosis of diabetes, it's important to also know how to control your diabetes so you will not have complications. Unfortunately, diabetes can affect all parts of your body, including your reproductive system, including your eyes, including your nerves, including your memory. It's a debilitating condition you don't want to develop. So thank you for coming. I know we're going to have a full house. At least I know our community is going to be represented. I think I can see COO somewhere out there. And I think I can see Chinyere, and I can also see Onyinye. That's the crew members. Immediately after my presentation, I'm going to have a repeat broadcast in Facebook. So if you're not able to join the YouTube, don't worry. After this, we're going to go to Facebook. Then we understand it better. It's important to take this particular condition very serious because even in pregnancy, some pregnant women can develop a specific type of diabetes we call gestational diabetes. Diabetes can also happen in kids. Matter of fact, if you have the family history of diabetes, or if you have a history of gestational diabetes or juvenile onset diabetes, the possibility you're gonna be fully diabetic is very high. So please pay attention, sit back, share this link with anyone out there. Make sure you pay attention. After my presentation, you will have an opportunity to ask all your questions. So what's diabetes? So diabetes is a group of diseases. So when I talk about group, it means any system in your body, any organ in your body can be the main focus of diabetes. So it can happen in your eyes, it can happen in your nerves, it can happen in your GI, it can happen in the reproductive system, it can happen in the liver, it can happen in the kidneys. So it's a group of disease, and the focus in the presence of too much sugar in the blood. So the bottom line in diabetes, it's high glucose level. So anywhere you see glucose, you can replace it with sugar. We are using sugar based on layman's terminology, but it's actually glucose. So that's the central point of problem in diabetes. It's a chronic condition. A chronic condition means a condition you will definitely have until you go. Unfortunately, it's not completely treatable. It can be managed to the extent of going off medication, but once you have it, you're going to manage it until you die, just like just like hypertension. So it's not something like malaria. Once you take a drug, you will be completely treated, or an infection. It's a chronic condition. Now, what is the major classifications in diabetes? Majorly, it's classified into two types. Type 1 diabetes. Type 1 diabetes is the type you can inherit from either your mom or your dad. Or if you have a sibling that have diabetes, it means you have familial tendency of diabetes. That's type 1. That one can be from birth. You're born into a family of diabetic, you became diabetic from birth. But the one we are gonna mainly focus more on today is type 2 diabetes. That one is called adult onset diabetes. So for some reasons, we don't know the exact cause of diabetes. So it's still unknown. But there are certain predisposing factors and there are certain common denominators. So in all cases of diabetes, there is a buildup of sugar in your bloodstream. That's where the problem starts. This is because There's a particular gland we call the pancreas. The pancreas gland elaborates insulin. The role of insulin is to manage all the sugar in your body. But when the pancreas is not performing optimally and there is no presence of insulin, or when your insulin is resistant, then there won't be any proper handling of the blood sugar. So what will happen? The blood sugar level will go up. So both in type 1 and type 2 diabetes, it's caused by a combination of genetic problems, things you can pick from your family, and environmental factors. So let's talk about the risk factors. What are those conditions that if you have it in you, around you, you can develop diabetes? Number one, if you are pre-diabetic. So before you become diabetic, you have to be pre-diabetic. So there's a particular number which I'm still gonna count. When we check your blood sugar, especially using A1C, if your number fell within a particular range, you are classified as being pre-diabetic. So pre-diabetes is the number one risk factor. If you are overweight, so this is where you need to be careful. If you punch your numbers and your BMI is above 30, you are likely going to develop diabetes. If your BMI is above 25, you are likely going to develop diabetes. Where do we want your BMI to be? 18.5 to 24.9. So overweight, obesity is also a risk factor to developing diabetes. If you are 45 years and above, likelihood you're going to develop diabetes. So it's adult onset. Now, if you have a parent, a brother, a sister, an auntie, an uncle, maternal and paternal, and they have a family history of diabetes, that's also a risk factor. If you are not physically active, at least more than 3 times a week, you are likely going to develop diabetes. If you previously had gestational diabetes during your pregnancy, if you have juvenile onset diabetes, you will likely develop adult diabetes. So these are the 6 major risk factors that will likely predispose you to developing diabetes. Now, I know you'll be wondering, what are the symptoms? What are the signs that someone might have that might be indicative of diabetes? Very important. I want you to pay attention to the major signs and symptoms. Some people will have it, some people will not have it. You might not have the 8 of them, but if you have some and you go for follow-up and we diagnose your diabetes, these are the things you should be on the lookout for. Number 1 is what we call polydipsia. You have increased taste. At any point in time, you want to drink water. At any point in time, you want to drink fluid. So the increase in your taste, hunger to drink something, it's called polydipsia. That's a classical presentation of diabetes. Now, this is because the glucose ordinarily that should be in your cells performing their roles are found in the sugar in the blood. So when you have sugar build up in your blood, it tends to attract a lot of fluid. So you are easily dehydrated. So polydipsia, which is increase in thirst, it's number 1 presentation of diabetes. Now, some people will also have polyphagia. You are easily in need of eating. So hunger, increase in hunger, you're more hungry. That's also a presentation of what? Diabetes. Polyuria means you go to the loo frequently. So in the night, you might go to use the restroom for almost 6, 7, sometimes 10 times. So it's a game of peas. The first one is polydipsia. You drink a lot of water, you drink a lot of fluid. The second one is polyphagia. You eat a lot of food. Then the third one is polyuria. You go to you do number 1 frequently. Dry mouth. Most people that have diabetes will notice they have dry mouths. This is from dehydration. Now, weight loss, unintentional weight loss. If you previously had a sizable body weight, but suddenly you are losing weight unintentionally, that means you are not intentionally losing weight, but suddenly you started losing weight, we must rule out diabetes. Fatigue, you're easily fatigued, you're easily tired. Blurry vision, one of the areas that diabetes can affect is the eyes. Headaches. So these are few symptoms which might be present in majority of people that have diabetes. Now, you might not have all these symptoms, but you have diabetes. So it's important to keep in touch with your family physician. Now, how do we diagnose diabetes? Thankfully, previously we used to prick your finger to check fasting blood sugar, random blood sugar, but there's a particular test that is very reliable. It's called A1C, hemoglobin A1C, glycated hemoglobin A1C. This blood test is very important because it gives us an average blood sugar level for the past 2 to 3 months. Very important. Now, if you've gone to your doctors, depending on the lab they are using, depending on your location, there are some numbers I want you to be conversant with. If we check your A1C and your percentage is below 5.7, it's considered normal. So if you have ever gone to check your A1C, you're going for your well woman check, we check your A1C is below 5.7, supposedly normal, until proven otherwise. However, we cannot use only one blood test to confirm diabetes. You would have done the first one, you go back for repeat before we can categorically monitor and say, you know what, you're not diabetic. There are some people that might be pre-diabetic, so the idea is to break that cycle of becoming diabetic from pre-diabetic. Now, if your A1C is hovering around 5.7 to 6.4, you are diagnosed of pre-diabetes. So if you notice, you have to graduate before you become diabetic. So we want your numbers to be below 5.7. Once your numbers are hovering around 5.7 to 6.4, at that stage you're pre-diabetic. Now, once your number is above 6.5 on 2 separate tests, it indicates you will likely have diabetes. Now, let's talk about prevention. I've been talking about things that will put a lot of fear in you guys. But how can we prevent diabetes? Or how can we control diabetes, assuming you've already developed diabetes? I'm going to be as simple as possible. The first one is your food. Your food is the most important approach to controlling diabetes, preventing diabetes. So make sure your food is high in fruits, in vegetables and nuts, then whole grains. If you want to prevent developing full-term diabetes, you must work on what you eat. You cannot afford to eat carelessly. You have to include fruits. You have to include vegetables, nuts, and whole grains. Then olive oil. They are associated with preventing you developing full-blown diabetes. You must stay active for at least 30 minutes every day. You cannot sit in one place and you're planning to prevent diabetes. You must move your body. You must lose that excessive body weight. Very, very important. Your BMI cannot be in the 30s and you're talking about avoiding diabetes. You must come down from the 30s. You don't have any business being in the 30s. You should be tending towards 24.9. Now, people, this is a journey. Majority of people are struggling with their body weight. We are talking about staying around to look after your responsibility. Of course, you don't have any business smoking. Both primary smoking and secondary smoking. Primary smoking means you're the person lighting the cigarette, you're smoking it. Secondary smoking means you're hanging around people that smoke. Avoid all forms of smoking. Now, some people might be prescribed some medications, so it's possible you're pre-diabetic and your provider can even give you metformin, which is a popular oral hypoglycemic we normally use in controlling diabetes. Please take those medications religiously. So precaution-wise, like I told you, if you have developed gestational diabetes, so in gestational diabetes, when you become pregnant, you are diabetic. Once you deliver your baby, you're no longer diabetic. We have to monitor you. There are some women that will eventually graduate from gestational diabetes to full-blown diabetes. So we must keep doing your A1C. You must keep checking your blood sugar for the past 2 to 3 months so we can prevent this. Now, in the interim, please, there are some conditions that will make your A1C not to be accurate, especially pregnancy and some metabolic diseases. So they can give you false positive, false negative. So before you're going for your A1C, we need to know your status. So let's elaborate a little bit more about the type of food you need to eat. Increase your fruits, vegetable, nuts, whole grains. Choose food low in fat and calories. So the key word is low in fat. It doesn't mean you don't need your fat. You still need your fat, but you need to be very mindful. And calories. So you need food that will have high fiber, high water content, low in calories, low in fats. Consume them. Then eat variety of food. Avoid eating out. Prepare your own meal. When you do this, you will be on your way to recovering your health. Be more active. Physical activity will help you to control your body weight. Physical activity will help you to use up sugar for energy. It helps your body to keep the insulin more effective. So aim for 150 minutes of moderate exercise or 75 minutes of vigorous aerobic activity every week. We can do this, just 30 minutes in a day. When you do this, you will put yourself in a better position to avoid developing diabetes. Now, you need to lose the weight. I've already mentioned that. So if your BMI is in the 30s, please come back home. If your BMI is above 25, please come back home. Of course, we don't want you to be underweight. You have to aim for 18.5 to 24.9. It works. If you can lose 5 to 7% of your body weight, that's about 14 pounds. You would have helped yourself significantly to reduce the risk of developing diabetes. Of course, I've already mentioned smoking. You don't have any business smoking. Besides diabetes, there are so many things that smoking can lead to, including your death. So you don't need that. Now take your medications religiously. If we can all collectively do this, we can effectively stop the progression from pre-diabetes to diabetes. Even if our parents have diabetes, we can modify our lifestyle. Even if you currently have diabetes, if you control it properly, we can take you off medications. This is my presentation. I'm going to give us an opportunity to start asking our questions. Now, admin, I want you to ask all your questions. At least I'm anticipating 3 questions from all the admins. So can I 3 questions, Chinyere, 3 questions, Tosi, 3 questions, Onyi, 3 questions from you guys, okay? Okay, my wife is in attendance and she's asking a question. Can you reverse diabetes with low carb, high protein diet like some social media are claiming? So here's the deal. Diabetes is a condition that once you develop it, you're going to manage it till you die. So be careful. It's not a dash, it's a journey. If you modify your lifestyle, which I've been hammering on, there is no medical condition you can handle with lifestyle modification. So when you modify your lifestyle, you can bring your diabetes to minimally, manageable level. It doesn't mean you've completely eliminated diabetes. It means you brought it to the level your body can handle it. So at that level, you and your body are in understanding. Okay, so there are so many claims out there. Definitely you need to reduce your carbohydrate intake by default, reducing your calorie, of course, up your protein, up your fiber, but they will not reverse completely. So be careful. This is an area that some people go over the board, claiming so many things, bogus claims. The only person that should give you a guide in regards to managing your diabetes is your doctor. You can go off your drugs. You can go off all your medications and you will continue to be on that good lifestyle. Are carbs really the enemy or is there a more balanced approach? Of course, you need your carbs. Of course, you need your calories. So the key word is moderation. So in as much as there are so many food items that will contain high carbohydrate, high fats, high calorie, you still need the fats. You still need your carbohydrate. You cannot survive without your carbohydrates. You can't survive without your protein. You can't survive without your calories. But the key word is moderation. So when you want to eat, be careful. Watch your portion size. Eat from all classes of food. Focus more on superfood. So if you're eating something you're not deriving nutrient from, why eat them? Limit the number of times you eat out because there are so many diabetogenic, food items out there. So avoid them completely. But please be careful of all those bogus claims about, stop this and this will be reversed. This is not malaria. This is not 1 + 1. It's something you have to understand as you embark on your journey. Then you keep modifying your lifestyle so that over time it becomes your habit. So you can try out a couple of things. You can completely have a complete overhaul of what you eat. So you have to remember you're eating to live. You are not living to eat. Okay, so that question is taken care of. Does diabetics affect egg quality? Yes, indirectly. So remember, when you are diabetic, the possibility you'll have obesity is high. The possibility you have overweight is high. And that can affect your hormone imbalance. And if it affects your hormone imbalance, the hormones that should be responsible for giving us quality egg will be depleted. So your reproductive hormones can be affected. Your estrogen can be affected. Your FSH can be affected. Your anti-malarial hormone can be affected. Your thyroid hormones can be affected. Your progesterone can be affected. And if they're affected, yes, the quality of your eggs can be affected indirectly. So if you want to be a parent, you have to bring your sugar level under control. I love that question. Can diabetics eat 2 eggs a day? Why not? You just have to be careful. There is no need for restricting your diet. But the last time I checked, eggs, when you eat eggs, you get your protein, you get your calories, you still get your carbohydrates. So we still have eggs, we still have carbohydrates in eggs. So the key word is the quantity. What quantity of protein are you consuming? What quantity of whole grains are you consuming? What quantity of calories are you consuming? So it's a game of quantity. Okay? For a woman that has gestational diabetes, will she likely be diabetic later in life if she doesn't modify her lifestyle? If she begins to live her life carelessly, she can graduate from gestational diabetes to full-blown diabetes. Because gestational diabetes is a predisposing factor to developing full-blown diabetes. But if she's diabetic during pregnancy and after her pregnancy, she continues to live properly, exercise, avoid stress, and go for her well woman check, then yes. But if she doesn't do all this stuff, she can develop full-blown diabetes. Can diabetic affect sperm quality negatively? The same way it can affect the eggs, yes, it can also affect the sperm quality through the same pathway. So if your partner has obesity, as a man, he can go through what we call aromatization. When you go through aromatization, men ordinarily should have more testosterone than women. But when your body begins to convert the testosterone to estrogen, then you will lose that body function. The same thing can happen to women. When your body begins to convert your estrogen to testosterone and androgens, you begin to lose your function as a woman. So the answer is yes. It might not be directly, but indirectly, it can affect your sperm quality. Doc, please, can diabetes cause miscarriage? Not directly, but indirectly. Anything that affects metabolism, anything that affects the way your body is meant to function can lead to problem in your pregnancy. So the answer is yes. It might not be directly, but it can. Why? If you have gestational diabetes, it means that your body is not handling the sugar properly, your insulin level is not optimal, and if you have any compromise in the way your body handles stuff, it can affect the way your baby is developing. So yes, it can lead to miscarriage, but indirectly. It's a metabolic problem. Okay, I love this question. So here we go for COO. Does sugar cause diabetes? Like I told you guys, we don't know the exact thing that causes diabetes. It's still unknown. But we know that if you have unaccelerated consumption of sugar, which has a lot of calories, and you don't balance out with other food, you predispose yourself to developing diabetes. So consumption of frequent sugary stuff, which has a lot of calories, is a risk factor. It's not a causative factor. It's a risk factor to developing diabetes. It doesn't cause diabetic directly. So I know so many people will go out there and say, oh, if you take raw sugar, you develop diabetes. That's not true. Okay, I love that question. Please explain the relationship between the body's insulin and diabetes. Okay, so here's the deal. There's a particular gland we call the pancreas. The pancreas produces insulin from what we call isolates of Langerhans. Now, when you have enough insulin, the role of insulin is to handle all the glucose, all the sugar in your body. So what happens when you eat? Insulin will go to the blood and push out all those sugar and glucose from the blood to the tissues where they should go and perform their role. Now, when you lack insulin, enough insulin, either you're not producing it, like people that have type 1 diabetes, they don't have insulin. So we have to give them insulin. So that's why it's called insulin-dependent diabetes and insulin-independent diabetes. So when you have enough insulin, which is produced from the pancreas, then your body can handle all the sugar in your body. But when you don't have it, you begin to retain blood. You begin to retain sugar in your blood, and that's where the problem starts, because your blood is not supposed to have excessive sugar level. When that happens, you begin to develop a lot of complications up and down. I love that question. Afternoon, doc. Is it possible to have normal glucose number and your hemoglobin A1C is higher now? Remember the numbers. When your hemoglobin A1C is below 5.7, you are supposedly normal. So everything regarding your sugar management, everything regarding your diagnosis should be in the same direction. So you can have normal fasting blood sugar, normal random blood sugar, then your A1C will be high. No, there's a problem somewhere. If you have a normal fasting blood sugar, normal random blood sugar, it's expected that your hemoglobin A1C should also be normal. They track each other. So you can't have normal one and abnormal one. They are all in tandem with each other. So you need to go back and check it again. Is diabetes hereditary? 100%. Type 1. So if your mother has diabetes, if your father has diabetes, you can actually develop type 2 diabetes, but you can also develop type 1 diabetes. So type 1 is the one you can inherit, but you can develop adult onset diabetes. Beautiful question. Does metformin affect male fertility? So metformin is a type of drug we call oral hypoglycemics. The essence of metformin is to help your body to manage those sugar you're not managing properly. Now, when you take it with appropriate instructions and supervision, definitely it's not going to affect the fertility. So it doesn't have a direct impact on your fertility. But some men can develop some complications, some side effects, especially if you're not living healthy. So if you're taking metformin and other couple of other medications and you're not staying active, you have a lot of stressors in your body, of course your libido is going to be affected. Of course your testosterone is going to be affected. And if your libido is affected and your testosterone is affected, then you're likely not going to develop diabetes. You're likely going to develop infertility. Okay? Can a thin person really be diabetic? This is a question I've been waiting for. Now, don't go looking yourself up in the mirror and feel, oh, I'm thin, I'm leper, then I don't have diabetes. The answer is 100%. Regardless of how you look, whether you're thin, whether you're rubber, whether you're leper, anybody can develop diabetes. If you follow my teaching, some people can start losing body weight unintentionally. That can be a presentation of diabetes. So thin people can develop diabetes. Obese people can also develop diabetes. It's not only for people that are heavy and people that have fats. It can develop in anybody. So don't go start eating all the food in the community because you think you're thin. Anybody can develop diabetes. I love that question. Is it true that some fruits are high in sugar and they can spike your blood sugar? 100%. 100%. Your banana has a lot of sugar. Your mango has a lot of sugar. Majority of all the fruits you will eat out there, they all have sugar. And the answer is yes. They can spike up your blood sugar. So it's still moderation. So in as much as they contain fiber and they can help you to regulate your blood sugar and all that, you still need to be careful the quantity you're consuming. The key word is not to avoid anything. It's the quantity you eat. So you can't survive without sugar. You will just die. But the key word is how much of them are you consuming? Are you consuming more than what your body needs? Okay? So guys, we still have 3 minutes to wrap up. If you still have questions, feel free. I'm actually happy that a lot of people attended the clinic today. This is very important. So share this video with everybody in your community. Make sure you set your notifications so that anytime I come live, you can see me and you can hop in and you can participate. So beautiful questions, beautiful feedbacks. If you still have any question, please feel free. Join me to our Facebook immediately after this. Should you randomly test for diabetes at home? No, but this is what you need to do. Generally, we recommend routine check for diabetes from age 35 and up. Because lately, we want to prevent certain things from happening. But I personally will not subscribe you staying back home and pricking yourself. Go establish with your doctor, your primary care doctor, and if you're up to 35, we can do the first baseline. So when we run your blood sugar, we run your CMP, we run your CBC, and we run your diabetic profile. So we do your A1C, we do random, we do fasting, then whatever level, because what happens in testing? The first test would determine if you're going to go for the second test. So if we suspect from your complete metabolic panel, from your complete blood count, from your A1C, from your random blood sugar, from your fasting blood sugar, if we notice you're tilting towards the higher range, then we can request a repeat. But don't stay back home and be checking yourself. Go through your doctors. Okay, Ima Magdalena, abstract question. After 2 weeks of miscarriage, you saw fertility, mucus, baby dance, but slight left abdominal pain. What could be the cause? It can be absolutely normal. The fact you have, so what's actually the worry? You had 2 weeks of miscarriage. After miscarriage, and your cervical, of course, your cervical mucus is going to be, struggling to kind of come back to normal. So what you should be bothered about now, it's not this whole cervical mucus thing. Of course, You can still feel pain here and there. When you've had miscarriage, your body is taking time to come back to normal. You're still pretty much fresh. So it's not unusual to have the discomfort you're having. Just chill. Okay, personally chill, especially 2 weeks. Completely expected to have this discomfort you're having. Okay? Can exercise help to control diabetes? 100 plus 100 plus 100%. That's actually one of the areas you can use to control the overall outlook of diabetes. So even if you're diabetic, if you can start exercising, if you can lose your body weight, if you can avoid stress, if you can eat right, your numbers are going to tank. When your number tanks, you can even go off medications that were previously recommended for you. So the answer is yes. Exercise is huge in controlling and managing your diabetes. It works like magic. What are the correlations between white food and diabetes? Of course, you have to be mindful your consumption of all those white rice, white pasta, white this, white that. The more you consume them, they are highly calorific and they have a high glycemic index. So they can spike your blood sugar faster than other alternatives. So there's a direct correlation between them. Okay? All right, thank you so much. My time is up. I appreciate you guys. Please be on lookout for June topic. We will announce our topic for masterclass today. Go and plan for the last Sunday of June. We will come big. You don't want to miss this. This is June. We have 5 more months to end 2023. So be determined to get something positive from our group. Thank you guys for coming. Thank you, COO. Thank you, Babe. Thank you, Tosi. Thank you, Evelyn. Thank you, Magdalena, and every other person. Please join me in Facebook and we continue the conversation. Until I see you guys, God bless you and enjoy your weekend. Bye-bye for now.